Minister, I'm delighted to be joining my colleagues on this issue. Minister, I've been contacted by a number of constituents who are suffering from this debilitating and chronic condition, including Aoife Halley, Rachel Ball and Amy Brown. All of these ladies have asked for our support. They are deeply frustrated at the fact, although their lives have fallen apart thanks to endometriosis, they feel they are hitting a brick wall when it comes to this government and access to pain relief. That's shocking, Minister. They feel unheard and they feel uncared for. The briefing last week, and thanks to Deputy Kenny, the AV room, was deeply moving. It was full of bravery. One of those ladies, Amy Brown, contacted me again today with further details about a consultant who performed incorrect and incomplete surgery on her, with the direct result that her life has been changed beyond all recognition. It is a scandal that these people, these women, this lady, young lady, have to go to such lengths to get appropriate treatment and support. And I'm looking for an absolute and categoric assurances, Minister, that the concerns of these ladies have raised, that they will be addressed without further delay and further embarrassment. It's a shocking state of affairs.
Minister Daly has 4 minutes.
And I would like to thank each of the deputies for raising this important matter here today and bringing it to the attention of the House. I understand that it is within the scope of a general gynaecologist to diagnose and treat the majority of cases of endometriosis. Therefore, a GP referral to a gynaecologist is a standard pathway of care for the management of endometriosis in Ireland. This is similar to the pathway in place for the management of other gynaecological conditions. Information provided by the HSE indicates that endometriosis can be a difficult condition to diagnose and treat because of the variation of presentations, which can affect the physical and indeed the mental well-being of patients to varying degrees. Treatment may include pain medications, hormone treatment and surgical interventions. The length of time it takes to diagnose endometriosis varies from patient to patient because of varying and sometimes ambiguous symptom presentation. However, the Minister is assured that the provision of training in the management and diagnosis of endometriosis forms an integral part of the specialist medical training programme provided by the Institute of Obstetricians and Gynaecologists. The HSE National Women and Infants Health Programme has advised that the best way to help the majority of patients with endometriosis is to improve access to gynaecology services. As such, the programme has developed a plan to increase capacity and reduce waiting times for women awaiting general gynaecology, which includes patients with endometriosis. The plan aims to reorientate general gynaecology services to an ambulatory or see and treat model rather than the traditional outpatient referral model. An ambulatory care model is a more efficient and effective use of resources. It is also better for the patient as it reduces the requirement for multiple outpatient appointments. The programme will progress this plan in 2020. It is also worth noting that a new Women's Health Task Force was established in the Department of Health in September 2019. The purpose of the task force is to improve women's health outcomes and women's experiences of healthcare. The task force is at an early stage of its work and is considering the full range of issues affecting women's health in Ireland. The task force will tackle a wide range of issues impacting women's health outcomes in Ireland and will work on these on a phased, prioritised basis. Each week, external experts in the area of women's health meet with members of the task force in the Department of Health to inform its work. This initiative has been underway since the task force was established. I understand that the Endometriosis Association of Ireland recently presented to members of the task force, highlighting this important issue which affects many women in Ireland. This issue will be considered by the task force alongside a range of other issues affecting women's health. Priority action areas will be decided by the task force in consultation with stakeholders, including the public. The first action of the task force will be to initiate a national listening exercise inviting women in Ireland to share their experiences of and solutions for the health system, and this will commence in early 2020. More information on the task force is available on the Department of Health website.
Thank you, Minister.